Yes, Carol, and I think we've all taken in a lot of medical information from the experts, but now we're hearing the real-life experience of a man in Saskatoon who's recovering. He contracted COVID-19 after a snowmobile rally in northern Saskatchewan, and now his family has it too. And we'll get to that story in a minute. Welcome to all our viewers across Alberta and Saskatchewan and right across the country. To help walk us through the events on the prairies today, I'm joined by Nancy Carlson, the host of CBC Edmonton News at 6, and Rob Brown, the host of CBC Calgary News at 6. Tonight we start in Saskatchewan. Today, the Health Authority opened a primary care assessment site in Regina. The goal is to make sure that ERs and clinics are not overwhelmed by COVID-19. The facility is by appointment only, and you need a referral to get in. The SHA says other sites will be established across the province as need arises. Let's look at today's numbers. It was actually 2 weeks ago today that Saskatchewan announced its first case. Today, the province announced 9 more cases, taking the total to 95. The majority of people diagnosed are between 20 and 64 years old. The province says there are now 5 people in hospital. 2 were in intensive care as of yesterday, and that hasn't changed. 3 people are now considered recovered. Now to the story I was mentioning off the top. Tonight we are getting a first-hand look at what it's like to have COVID-19. 51-year-old Todd Rowan is in Saskatoon, and he was at a snowmobile rally 2 weeks ago at Christopher Lake, north of Prince Albert. 4 days later, the symptoms appeared. The CBC's Dan Zakreski brings us the story.
Todd Rowan says it happened fast.
Fever, aches and pains, chills, really bad dry cough.
How fast did it come on?
Within 2 hours. It was just thinking there was something wrong. It was some different type of flu. That was going through my mind.
How was it different than other ones for you?
Just the severity of the pain and the uncomfortableness.
Rowan called his doctor here in Saskatoon and arranged to be tested. 2 days later, the test results came back positive. He had the COVID-19 virus. Within days, so did his teenage son and his wife. Saskatchewan Health Authority is asking anyone who was at this snowmobile rally on March 14th to self-isolate. The rally was north of Prince Albert and wrapped up with a dinner. 2 people from the rally have since tested positive. Todd Rowan was there. He thinks he picked it up after the event while having drinks in a fishing shack. A week into being sick, and he says this isn't something you want to get.
You know, if I was a farmer, I'd be social distancing everyone on my farm. If you got what I had if you caught it during seeding, you wouldn't be able to turn a wheel yourself. This is the best I've felt, and this is 8 days. And I still feel clammy and sweaty, but at least I have some energy today.
Rowan works as a marketing consultant with farmers, so working from home has never been a problem. But now, after 8 days, he says he finally feels like working. Dan Zakreski, CBC News, Saskatoon.
In Saskatchewan, the Ministry of Health is putting a limit on the amount of asthma medication that pharmacists are giving to patients. The province says there's been an unprecedented increase in demand for inhalers since COVID-19 came to Canada. Because of this, the Health Ministry is directing pharmacists to give out 1 month's supply of medication to patients, except in special circumstances. In La Ronge, Alexander Ashton says he recently called his doctor when his prescription ran out. He was told he may not be able to get it filled soon, and this is adding more worry in an already stressful time.
I've had it beside me my whole life, and now I just don't. So now, I'm having troubles breathing. Well, if things get a bit worse, it's like, what do I do? Just sit and wait it out for days? Or
The Canadian Association of Pharmacists says it is trying to ensure medications are being dispersed responsibly right now. It's asking people not to stockpile medication or request early refills unless absolutely necessary. The Saskatchewan government now says residential evictions will be suspended due to the COVID-19 pandemic. Yesterday, the government said additional attention was being given to COVID-19 related hardships during eviction hearings, but the opposition and the city of Regina asked the government to cancel the hearings altogether. Today, the province agreed to halt eviction hearings unless there's property damage or other safety considerations. If tenants are not able to pay their rent, they should work out a payment plan with their landlords. Basic needs like shelter and food security are things people are worrying about right across the prairies. In Edmonton today, Alberta's Agriculture Minister offered some reassurance, including availability to Indigenous communities and rural areas. Let's go to Nancy Carlson. Nancy, there has been a lot of concern about empty shelves and panic buying.
Yeah, and you know, Sam, it seems this announcement by the Agriculture Minister is a bit late, but he actually wanted to reassure people that they're making sure everyone has access to food, and that's a priority. And it's the increase in demand and not a missing link in the supply chain that's causing the problems we've been seeing. So he was calling on shoppers not to stockpile groceries and supplies. Lineups have been long and shelves, they've been emptied. People are panic shopping. Minister Devin Dreeshen says efforts by the government to support the food industry start right at production, and the government is pushing the feds to declare agriculture as an essential service.
An essential service ultimately just goes to show the importance of that industry, so that if they were to be shut down, that it would have broader economic effects that would ripple through society. So that's obviously food being so essential that we all need to eat is something that, you know, other types of industry like our, you know, water supply systems or other critical infrastructure, we want to make sure that will always be maintained.
Now, when it comes to some non-essential services, as the City of Edmonton renews its state of emergency, which expires every week, it is implementing the closure of personal care businesses. So that includes things like hair and nail salons, tattoo parlors, and body rub centers. The mayor says these businesses involved close contact with people, and even though they considered extra protective measures, they believe closing them is really the best option to keep Edmontonians safe during the pandemic. Now, while the closure order does come into effect immediately, they will be working with owners, including the 1,500 home businesses affected, to comply.
We certainly would ask if you're in one of those businesses, and we recognize the challenging times we're in, and sort of really appreciate the challenge this is creating for you. But you can help us. That if you can take your steps on your own to close, that certainly helps our peace officers and our EPS to navigate through that.
Another mention from the city is an update on the temporarily closed Kinsman Sports Centre. It is now being used as a safe space for Edmonton's homeless. The Mustard Seed organized and set the whole place up in just 3 days. Up to 180 people can stay there. It's for people who need a warm place to stay, and they can go between 8 p.m. and 7 a.m. And the group thinks they will be at capacity in just a couple of days. Now, it isn't for people who may have COVID-19, and they are taking several precautions to keep everyone safe.
People, as they come in, will get triaged if they have a high fever, if there's a noticeable cough, if there's any of those other symptoms that we're all to look for. They'll be asked to move to an isolation tent, and at that point, an individual would be picked up either by 211 or through the Hope ambulance and taken to the expo center and then admitted to the shelter there that is for people who are symptomatic.
Even though those extra measures are being taken to identify carriers as soon as possible and get them into isolation, not just within the homeless population, but everywhere, Alberta's Chief Medical Officer of Health says the community spread is their biggest concern.
As of today, 33 cases where we don't know where they acquired disease. It's clear that we have cases in the community that we have not detected. So those 33 cases are the tip of the iceberg, and there are other people who we have not detected who are out in the community who have spread the disease, and there may be others who are continuing to spread it.
So one more note, Sam, 5 more residents at the Mackenzie Town Continuing Care Centre in Calgary have tested positive. That brings the total in the one building to 14.
All right, thanks, Nancy. Nancy Carlson is the host of CBC Edmonton News at 6. So what do the latest numbers tell us about where this outbreak is headed? Rob Brown joins me now, and you've reached out to an expert in that field.
Yeah, a prominent Canadian epidemiologist, Sam, who is with an advisory group to the World Health Organization on COVID-19. Dr. John Conley is an infectious disease specialist at the University of Calgary and past president of the Canadian Infectious Disease Society. So, Doctor, what do these latest numbers, 486 cases in 3 weeks in Alberta with 67 new cases announced today, what do they tell you about the state of the outbreak in our province right now?
You know, this is really no different than what we've seen in other settings around the world. The doubling time in many of the settings in countries around the world is anywhere from 2 to 7 days. If you do the math, and it's easy enough to do if you follow along with the cases that are occurring in Alberta, it appears to be doubling about every 5 days at this point in time.
So what is that comparable to? And everybody wants to compare to the worst case scenario, Italy.
You know, worst case scenario in Italy, they ramped up with respect to the number of cases and had a more rapid doubling time. And it was in all likelihood that in Italy, they had a large number of undocumented cases that were occurring, that were spreading in the Lombardy province, where they have a large cohort of elderly people.
So when those daily numbers are released, new overall total, new cases overnight, new cases of community spread, is there one particular metric that you focus in on more than others?
I think at this point, the metric that we're looking at is the community cases, the community spread.
And we only have 34 cases of community spread out of the 486. So is that encouraging to you at this point in indicating we are flattening that curve?
That's encouraging, but you have to also look at the rate of rise with respect to the number of community cases that is occurring. And it is much less steep than the number of travel-related cases. So in a sense, that's some good news, but it's a little early to be able to tell what's going to occur.
And of course, that requires testing and testing and testing, as the WHO has said. Premier Jason Kenney says Alberta ranks 4th in the world for per capita testing, but there's only so much capacity. I don't have to tell you, and testing protocols are now being narrowed. So I wonder, are you confident that we'll be able to continue to capture an accurate picture of community spread?
Let's hope so. I think the strategy is to be able to capture healthcare workers, obviously, and also the elderly population who are most at risk.
After several months of strict quarantine in Wuhan, officials there are only now talking about easing restrictions, and scientists are warning it may be too soon. So how long do you think Albertans should expect the restrictions in this province to last?
That's a difficult question to answer, and it's not one that I think I have a crystal ball to be able to give you an answer. Certainly, I think many people are thinking that given the figures from many other provinces, and this is widely in the public domain, people are hoping that within Alberta, within Canada in general, we will come to a peak somewhere around the end of April, beginning of May, and then we'll see where things go from there. So let's hope that the early work that's been done within Alberta and the aggressive testing capacity that's been undertaken and the social distancing, and as long as people are complying with some of those public health recommendations, let's hope that we'll see it flatten out and then descend from there.
Dr. Conley, we really appreciate your time. Thank you so much for this.
You're welcome.
He's a guy with a lot on his plate right now, but what's keeping him up at night is what other people are doing, Sam, those who aren't complying with those public health measures.
Thanks, Rob. Rob Brown is the host of CBC Calgary News at 6. And before we leave you from the prairies tonight, a trend that's being seen across the globe is taking some smaller communities by storm. This is how things looked and sounded last night at 7 o'clock in Gravelbourg, Saskatchewan. It's a nightly show of appreciation for healthcare workers. People say they want to clap and cheer and bang on pots and pans to remind everyone that frontline workers during this pandemic are very much appreciated. And I hope those busy healthcare and frontline workers are hearing all those pots and pans. They certainly deserve all that love.